Let's understand Medicare in a way an AR caller needs to understand it. Because when a Medicare claim is sitting in AR, you have one mission. Who should pay this claim? Why did they not pay? And what do I need to do next? So, let's start with the basic question. What is Medicare? Medicare is a federal health insurance program mainly for people aged 65 and older. It also covers certain younger people with disabilities and people with end-stage renal disease. For an AR caller, Medicare can be understood through two main ways of receiving Medicare benefits. Path 1. Original Medicare. Original Medicare generally means Part A and Part B. The beneficiary receives Medicare benefits through the traditional Medicare program. Path 2. Medicare Advantage. Medicare Advantage is also called Part C. It is an alternative way to receive Medicare covered benefits through a private Medicare approved health plan. And this difference is extremely important for an AR caller because it can change who should receive your claim. Medicare has four main parts: Part A, Part B, Part C, and Part D. Let's make them simple. Medicare Part A mainly covers inpatient hospital-related services and certain other institutional services. For example, inpatient hospital care, skilled nursing facility care, hospice, and certain home health services. For AR purposes, remember, hospital or institutional claims are generally billed using the UB04 claim form. Next is Medicare Part B. Part B generally covers physician services, outpatient care, preventive services, durable medical equipment, and other covered medical services. For example, doctor visits, office services, professional procedures. For AR purposes, remember, professional and medical claims are generally billed using the CMS 1500 claim form. Now we come to Part C, also called Medicare Advantage, and this is where many beginners get confused because Medicare Advantage is not original Medicare. For example, a patient may say, I have Medicare, but when you verify the insurance, you may discover that the patient actually has a Medicare Advantage plan. Medicare Advantage is an alternative way to receive Medicare covered health benefits through a Medicare approved private health plan. It generally provides Part A and Part B benefits, and many plans also include Part D prescription drug coverage. So here is the AR rule. Do not automatically send the claim to original Medicare just because the patient is eligible for Medicare. First, check. Does the patient have original Medicare, or does the patient have a Medicare Advantage plan? If the patient is enrolled in Medicare Advantage, the claim is generally handled according to that plan's billing, network, authorization, and claims processing rules. So before you take action, verify the actual plan, because Medicare eligibility does not automatically mean you should bill original Medicare. The fourth part is Medicare Part D. Part D mainly covers prescription drugs. For a typical medical AR caller, working physician or facility claims, Part D is usually not the payer you are following up with for a medical claim. Now here is something very important you need to remember. Original Medicare, Part A and Part B, does not have one single overall yearly limit that caps everything a beneficiary may have to pay out of pocket for covered care. That means the beneficiary can still have deductibles, co-insurance, and other cost-sharing responsibilities. Because these costs can add up, some people choose additional coverage to help with their share of healthcare costs. For example, some beneficiaries may have Medigap, which is supplemental coverage that works alongside original Medicare. Others may choose Medicare Advantage, which is a Part C private Medicare approved plan. But remember, Medigap and Medicare Advantage are not the same thing. So as an AR caller, do not look only at the patient's age or simply see the word Medicare. Verify the patient's actual coverage and actual payer. Now, let's talk about one of the biggest Medicare AR questions. The patient has Medicare and commercial insurance. So which insurance should you bill first? Here is where many AR callers make a mistake. They assume the patient has commercial insurance, so commercials must always pay first. That is not always correct. Under Medicare secondary payer or MSP rules, the correct payer order depends on the patient's specific situation. Your first job is to find who is the primary insurance. Primary insurance means the insurance that should receive and process the claim first. The other insurance may be secondary, but never decide based only on the name of the insurance. You must verify the situation. For example, let's say John has Medicare. John also has commercial insurance. The claim was sent to Medicare. Medicare responds, another insurance may be responsible first. Now, do not blindly resubmit the claim to the commercial insurance. First, investigate. Ask, does John actually have another active insurance? If the answer is yes, then ask, which insurance is actually primary? Check the insurance information, the patient's coverage, the payer response, the claim history, and the patient's situation on the date of service. Then take action. Maybe the commercial insurance should be billed first, or maybe Medicare should actually be primary and the insurance information needs to be corrected. Never assume, verify. That is the real AR mindset. Here is a very common example. The patient is 65 or older. The patient is actively working, and the patient has a group health plan through their current employment. Now the employer size becomes important. If the employer has 20 or more employees, the group health plan generally pays first. Medicare generally pays second. If the employer has fewer than 20 employees, Medicare generally pays first. The group health plan may pay second. So do not simply ask, does the patient have Medicare and commercial insurance? Go one step deeper. Ask, is the patient actively working? Is the insurance based on current employment? How many employees does the employer have? What was the coverage status on the date of service? Because one wrong assumption about payer order can create. Wrong payer billing leads to denial, leads to rework, leads to more AR follow-up. And nobody wants that. Now, here is another Medicare reality that can surprise AR callers. You may have the same procedure, the same CPT code, and similar documentation, but Medicare coverage rules may not always be the same in every area. Why? Because Medicare claims are administered in different jurisdictions by Medicare Administrative Contractors, also called MACs. MACs can issue local coverage determinations or LCDs. An LCD explains Medicare coverage requirements for certain services within that MAC's jurisdiction. So a service that meets the coverage requirements in one MAC jurisdiction may not automatically meet the requirements in another. That means the same CPT code does not automatically mean the same Medicare coverage decision everywhere. So when you are working a Medicare denial, don't guess. Check which MAC processed the claim. Is there an applicable LCD or Medicare coverage policy? Does the diagnosis support medical necessity? Does the documentation meet the coverage requirements? What exactly is the denial reason? And remember, do not confuse Medicare's MAC and LCD rules with Medicaid rules. Medicaid is jointly administered by the federal government and individual states. So Medicaid policies can vary from state to state. But for a Medicare medical necessity or coverage denial, your focus may need to be on the applicable Medicare coverage policy, MAC jurisdiction, and LCD when relevant. So when a Medicare claim lands in your AR queue, don't panic, don't blindly rebill, and don't assume Medicare is always primary. Instead, ask, what type of Medicare coverage does the patient actually have? Original Medicare or Medicare Advantage? Who is the correct payer? Who is primary and who is secondary? Does MSP apply? Check the correct payer order under Medicare secondary payer or MSP rules. Is there a coverage or medical necessity issue? And then verify the facts. Find the real reason for non-payment. Take the correct action. Because real AR work is not about guessing. It is about asking the right questions before you touch the claim. That is how an AR caller turns a confusing Medicare account into a clear next step.